Mr. Keith.
Good morning, Milady. We propose to start today's evidence, Milady, with the evidence of Professors Tom Shakespeare and Nick Watson, please.
Professor Shakespeare, if you'd repeat after me, I do solemnly.
I do solemnly.
Sincerely and truly.
Sincerely and truly.
Declare and affirm.
Declare and affirm.
That the evidence I shall give.
That the evidence I shall give.
Shall be the truth.
Shall be the truth.
The whole truth.
The whole truth.
And nothing but the truth.
And nothing but the truth.
Professor Watson, if you'd repeat after me, I do solemnly.
I do solemnly.
Sincerely and truly.
Sincerely and truly.
Declare and affirm.
Declare and affirm.
That the evidence I shall give.
That the evidence I shall give.
Shall be the truth.
Shall be the truth.
The whole truth.
The whole truth.
And nothing but the truth.
And nothing but the truth.
Professor Shakespeare, could you commence, please, by giving your full name?
So I'm Professor Thomas William Shakespeare, and I am Professor of Disability Research at the London School of Hygiene and Tropical Medicine.
Thank you. And Professor Watson, you too.
I'm Nicholas Watson, and I'm Professor of Disability Research at the University of Glasgow.
You have both been good enough to produce a joint report to this inquiry on structural inequalities and disability. And there we have it, INQ 280067. At the bottom of the page, of that first page, professors, if I can address you collectively, have you provided confirmation of the accuracy and the substance of your joint report?
We have.
Yep.
And it's the declaration is dated the 21st of September 2023. Can I turn, please, to your professional qualifications? Professor Shakespeare, you've told us that you are Professor of Disability Research at the London School of Hygiene and Tropical Medicine. Have you written extensively on the issues of disability, development and bioethics for many years now?
I have. I got my PhD in 1995, and since then I've written mainly about Britain and disabled people's experience.
Thank you. And Professor Watson, you are, as you've told us, Chair of Disability Studies and Director of the Centre for Disability Research in Glasgow, the University of Glasgow. Have you also written for many years extensively on a range of disability issues?
Yes.
And do those issues, for both of you, cover obviously the issue of disability, but in your case, disability in childhood, social care, social support for disabled people, disabled young people, and public service reform and poverty?
Yes.
Yes, I have.
Right. Gentlemen, whilst you give evidence, please, if you could remember to keep your voices up and speak as slowly as you humanly can in order to aid our stenographer. And if I ask a question, the meaning of which is not clear, please don't hesitate to ask me to put the question again. And we have, in the interests of transparency, discussed the way in which you are proposing to give your evidence. One of you, you've had a think beforehand, will go first in answering the particular topic that I raise, and if the other then wishes to add an answer or add some explanatory further comment in relation to that topic, then of course you'll do so. The report commences on page 3 with this statement, which I might observe would, I hope, be taken to be a statement of the obvious. The potential for disabled people to be at higher risk of harm from COVID-19 was well understood before the pandemic took full effect. You refer in the report thereafter to two particular pieces of learning, one from the US Centre for Disease Control. But in your joint opinion, was it obvious that in the face of a viral pandemic, both the pandemic and the response of the government, the response of any government, would be likely to have a disproportionate impact upon disabled people?
Yes, it was. We feel from the evidence that disabled people not only have a primary vulnerability, not all, but some, a primary vulnerability to a SARS-like infection, but they also have a narrow margin of health and are more likely to be in a situation of deprivation.
Do you, in fact, identify in your report 5 separate areas in which there was potential, and the potential, as you've said, must have been well understood, potential for greater vulnerability and impact?
Yes, yes, we do.
Let us see whether we can identify each of them, drawing the threads together from your report. So firstly, in terms of vulnerability, do disabled people suffer from a greater vulnerability in terms of their overall health?
Not all, but some certainly, and particularly people with intellectual disability or with who are older would be more vulnerable to an infection of this kind.
Secondly, is there a greater vulnerability in terms of clinical vulnerability? That is to say, a propensity to become infected, to be vulnerable to the virus itself?
For some people, not for all, particularly for people living in congregate living situations, who are more likely to be older or disabled. They would, by virtue of their proximity to each other, but also people who have suppressed immune systems as a side effect of their primary condition, would be more likely to become infected and therefore become ill.
I'm sorry, Professor, I missed the word, and I think the stenographer did too, living in something living situations.
Sorry, congregate living situations.
Congregate.
So many, certainly older people, but also people with intellectual disability, mental health conditions, may live together. It might be not necessarily an institution, which would be the past experience, but more congregate than most of us would live in.
Professor Shakespeare, whilst you give evidence, could I ask you just go a little more slowly? These are important and well, scientific issues in part, and it's very important that we understand what you have to say. The third area that you identify in your report is that of the greater risk of infection on account of the socioeconomic conditions of some disabled people. So that is to say, the greater risk of infection from their housing or from a general deprivation. Professor Watson, do you want to agree with that proposition?
Yes, I think so. I think for some disabled people, I mean, Tom's talked a lot about how disabled people can be vulnerable to SARS-like viruses, but disabled people can be made vulnerable to SARS-like viruses as well. And I think that what we've seen here is that through structural inequalities, we've placed disabled people in a position where they're more at risk both of acquiring a SARS-like virus, but also of not responding as well to a SARS-like virus, should that happen.
Then, fourthly, is there the issue of resources? So some disabled people may have a greater lack of access to the necessary health and care resources which would plainly be needed or required in order to be able to combat
There's evidence
of the virus.
of significant inequalities in access to healthcare for disabled people. I mean, there's a substantial body of evidence to show that disabled people face discrimination when trying to access healthcare.
But can I add to that? In addition, some disabled people, not all, have higher needs for healthcare, whether that's a physical healthcare or psychiatric healthcare, and therefore, if their primary physician is, as it were, diverted, they would be at some risk.
And although, Professor Watson, you use the word discrimination, in this context, we're examining, are we not, objectively, a lack of access to health and care resources?
Yes.
Is your point that some disabled people, for whatever reason, may encounter a greater lack of access to the resources that are required in order to be able to combat the virus?
Yes.
All right. And then lastly, do you identify this last fifth area, which concerns the general impact, which you say is disproportionate, of the pandemic control measures which the government brought into effect in order to combat the virus?
I mean, I would say from the evidence that we've seen, there would be the way in which, for many people, their social world is constructed by the state and voluntary organisations. I'm talking about particularly people with intellectual disability. And therefore, when that is all has to be withdrawn, they will, what can they do? They will stay at home and watch television. And there are other people who, the nature of the pandemic control measures, there were a certain number of people who were, as it were, given priority in shopping, but that we excluded from a lot of other people. Things like social distancing. If you're visually impaired, that it's impossible for a guide dog to understand what is necessary. So all of those aspects would be more difficult.
I think,
Yes.
sorry, I think also, you know, moving things digitally online works for a lot of people, but obviously there was a lot of that we point to the digital exclusion that disabled people are more likely to experience. So one of the responses to the COVID pandemic was to move things online. Well, if you're digitally excluded, then that greatly increases the disadvantage experienced by those who are digitally excluded.
So you've both given some examples of the ways in which the government decision-making and the restrictions that it applied on the population as a whole would have had a disproportionate impact on disabled people. But the nub of it in relation to this fifth category is this, isn't it? That the government decision-making and the measures it imposed had a direct impact on the day-to-day lives of disabled people who, because they are disabled, would therefore tend to be disproportionately affected by that impact.
Yes.
Yes, that's true. And I would add to that that disabled people were an afterthought in many of the provisions. They were not centrally thought about, and therefore they were excluded from measures that were taken to protect the general population.
By that, Professor, do you mean that when one examines the non-pharmaceutical interventions, the social restrictions, the lockdown orders, the stay-at-home orders, the social distancing and so on and so forth, the measures that were put into place, on their face, they don't appear to pay any regard to this particular part of society?
Exactly. Yeah.
All right. So that we are clear, however, as to the extent to which you are asked to look at this area by the inquiry, we did not seek, we didn't ask you, in fact, to look at the actual nature, specifically of the government response, and see to what extent the needs of disabled people were expressly considered.
We cannot comment on that. We haven't studied it.
Thank you very much. Well, that's very clear. Can we now turn, please, to some of the figures that you produced, very helpfully at paragraph 3 of your report. The Department for Work and Pensions produced a survey, the Family Resources Survey. Did it estimate that in 2021, 22% of the United Kingdom's population reported a disability?
Yes, it did.
And what is meant, or what was meant in that survey by reported a disability? The inquiry has seen, and we'll come to this tomorrow, some ONS data, both by way of statistical material and also what's called an opinions and lifestyle survey, that those who are disabled have the ability to be able to report whether they are disabled a little or disabled a lot. What sort of reporting structure was the foundation for this survey?
Well, that would have been a survey of people claiming benefits and people not claiming benefits, and therefore I think it wouldn't take the definition of disability in the Single Equality Act, which is the physical or mental impairment is substantial and long-term adverse effect on their ability to carry out normal day-to-day activities. That is what is meant.
Thank you. The survey post-dated the pandemic, at least insofar as it drew upon figures from 2020 to 2021. Is it possible to say from the survey or from your own researches to what extent levels of disability have fluctuated in the course of the pandemic or as a result of the pandemic?
That would be supposition on our part. We don't have that data.
All right.
I don't think that these data would be sensitive enough to pick that up, but I think there is a possibility that we could look at that.
For those of state pension age, 46% reported a disability, and the figure for those of working age was 21%. The figure for children was 9%, and 24% of females reported a disability compared to 20% of males. Did those figures for, or based upon the criteria of age or sex or occupation, vary by jurisdiction?
I think that, generally speaking, people in Scotland and Wales tend to have a higher rate of disability than people in England, because disability is related to deprivation. There's a strong poverty gradient, and therefore you can see that Wales has got the highest figure. In this statistics, Scotland's got the lowest, but there are others which would put it higher.
I think that there's a huge variation. No one knows. When this report came out, lots of people have been speculating as to why Wales has such a high figure. Sorry, but no one really knows, because it could be age. It'll be a mixture of age, poverty, and other industrial legacies of industrial injuries and things.
Although we didn't ask you in the report to address this issue, are you able to say how these figures compare to other comparable Western European countries?
The trouble is, I'm sorry to disappoint you, but people use a different definition of disability. Britain has got the highest levels of disability in Europe, but that may be an artifact of the way that we count disability. Norway and Germany, Norway 10.7, Germany 9.4. Those are not what we would count as disability. We are more like France at 17.8, Switzerland at 20.9. I think Sweden is about the same. So those would be comparable to us, but we would caution extreme care, because we're not clear on what basis they've defined people as disabled. Our disability is a bit like a piece of string. It depends where you cross the line.
Thank you. Well, that's extremely clear and not altogether surprising. Your report then deals in general terms with three areas: vulnerability, the areas in which disabled people suffer the greatest degree of vulnerability; the areas, secondly, in which they suffer from discriminatory practices; and thirdly, the issue of access to resources, and in particular to health and care resources on the part of the state. So picking up firstly that issue of vulnerability, is it well established that in general terms, and I emphasize in general terms, disabled people have a much narrower margin of health and face significant health inequalities? What is meant by a narrower margin of health?
People, I think, are more likely to have secondary conditions, that is, conditions consequent on their primary health condition. They're more likely to be poor, and therefore they might have comorbidities, which are unrelated to their primary condition. And of course, things like age or gender would also have a role.
I think they're also more likely to respond less well to a health challenge, because there's an increased vulnerability. So if they get flu, they're more likely to face mortality or morbidity resulting from flu.
because they are more vulnerable.
Because they're more vulnerable, they've got that narrower band of health, would be the way.
Now, you've referred to comorbidities, Professor Shakespeare. Are comorbidities serious health conditions from which a person may suffer alongside the disability or some other aspect of their day-to-day life or their societal position? So in the case of a disabled person, they may suffer from hypertension or heart disease or respiratory disease alongside the disability.
Exactly. And if I can take the example of people with intellectual disability, often people are overweight or obese, and of course there's lots of consequent health risks on that, as well as any primary health risk they might have because of their intellectual disability.
As a general proposition, it's obvious from this report and the other reports that the inquiry has looked at that there's a great need for care and a degree of nuance when examining these issues. A disabled person may have a greater chance of suffering from a comorbidity, not because they are disabled, but because there are aspects to their day-to-day life or their condition of which the disability is a part, which exposes them to a greater risk of that comorbidity. Is that the position?
Exactly. So taking the example of people with intellectual disabilities that I provided before, often they're supported by other people and often they might eat ready meals. Those might contribute to their obesity. They're not eating a balanced diet, in other words, because that takes time to prepare.
I think work from colleagues in the Scottish Learning Disability Observatory estimate that at age 20, a person with a learning disability has the same number of comorbidities as a person without a learning disability at age 50. And a lot of this is down to poor access to healthcare or also to inequalities experienced throughout the life course as they go through. So I think it's and the fact that they live in poverty. There's this disability and impairment and poverty is a circular relationship. So we know that poverty causes disability, but we also know that disability can create poverty. So it becomes like a positive feedback loop, and it can exacerbate the problems of poverty, and then poverty exacerbates the problems of disability. So it's that circular relationship, if you like, that you get through there.
And with that in mind, do you then go on to identify certain vulnerabilities or aspects of disability which has made those persons who are disabled in this way more vulnerable to the COVID-19 disease? And the first vulnerability you identify is age. Does disability entail a strong age gradient? Or putting it another way, a significantly large proportion of elderly people have a disability.
Absolutely, yeah. Far more so than in younger people. So something like up to 50% really on average of people, 47.41% females. That's of older people who are limited a lot.
And it may be an obvious feature. Do you conclude, therefore, that approximately half of people significantly affected by disability are over 60?
That is statistically correct, yeah.
And again, they are disabled, or they suffer from a disability, or they have a disability, not because they are elderly, but because they have a disability associated with age. There's a convergence of condition, if you like.
Exactly, and many older people are perfectly fit and well and no disability at all.
What about the connection or the link or the convergence between disability and intellectual disability and health? You refer in the next paragraph to people with intellectual disabilities having as many health conditions at age 20 and at age 20 as the rest of the population age 50 and over. Is that a significant aspect of disability?
We would say so. And so, for example, the relative risk of respiratory related deaths is 2.5 times higher for people with mild intellectual disability and 5.8 times higher for people with profound and multiple intellectual disability. So the more severe the condition, the more they're likely to have poor outcomes and to contract respiratory infections.
So if you have an intellectual disability of the type that you've described, you are more likely to catch and to suffer from a respiratory disease or condition, and indeed to die from it.
Yep, indeed. And during the 2017-2018 flu epidemic in the Netherlands, people with intellectual disability were 3 times higher deaths than in the general Dutch population. And often it's younger people as well. It's very unlikely for a young person without intellectual disability to become seriously ill. It's not unlikely for a person with intellectual disability.
Whilst reminding you, please, to keep your evidence as slow as you can, are there other groups of disabled people who are at increased risk of respiratory infection?
I think many groups, there's lots of different groups that we could look at. People with MS, with multiple sclerosis, for example. You could talk about being known to be at increased risk of viral infections. People with spinal cord injury are more likely to be at risk of respiratory infections. Same with rheumatoid arthritis and many other conditions like people with CO, chronic obstructive airways disease, or coronary heart disease, diabetes. So a lot of what we might call chronic illnesses, but also have will also be included under disabled people. So all of these put people at increased risk of respiratory infections.
And may I ask, professors, is that feature, is that increased vulnerability well known? Is that something that's known not just within your particular specialty, the field in which you are expert, but known more widely?
I would say it is known more widely. It's known through public health. It's known, obviously, through disability research, and it'd be known through social policy. It'd be very evident.
I mean, I think that the fact that respiratory infections are the major cause of death of people with a learning disability, it would make it that obviously would be very well known, or should be well known by anybody who works in this area.
The next category you identify is that of self-isolation. Do you make the point that on top of the intrinsic vulnerability to COVID, a disabled person's needs for care and support may mean that it's much more difficult to self-isolate and thereby to reduce the risk of catching the virus in the first place?
Absolutely. I mean, we've talked about disabled people who live in congregate living situations. Now, you can shut the door, but you need somebody to dress, undress, feed, transport you, and often it's the same person who performs those services for somebody else. So it might be in a care home, it might be in your private home, but very few people work only for one person, and therefore to isolate might be to shut yourself off from sources of care and support.
Thank you, that's very clear. You then turn in paragraphs 13 and 14 to the issue of unequal access, the topic that I introduced at the beginning of your evidence. Lack of access or inequality of access to healthcare. It is self-evident there may be some disabilities which require a greater degree of access to health and care support. In very general terms, and we're not, of course, looking in detail at the nature of health and care resource in the United Kingdom in this module, but in very general terms, are there inequities or variations in the degree of access?
Yes, I mean, there's a significant body of evidence that points to the disadvantage disabled people face when trying to access healthcare, and then when they access healthcare, about their health needs being poorly understood, that are specific to their impairment.
You then turn to the issue of discrimination, and you refer to you make the general proposition, you express the general opinion that despite over 20 years of anti-discrimination legislation, disabled people in the United Kingdom continue to face disadvantage compared to their non-disabled peers. And I should make plain what is, I hope, obvious, which is that this is not an inquiry into discrimination or into the needs of disabled people or any other part of the population. But that level of discrimination is plainly relevant to the degree to which the government could or should have responded to the pandemic by measuring its responses in light of that degree of discrimination. Has this issue of how a government might, in an emergency situation, respond to dealing with the needs of disabled people, been raised at the UN level in the past few years?
Yes, in the 2017 or 16 response, the committee in paragraph 28 in its report on that we refer to in paragraph 16 that the inquiry concerning the United Kingdom of Great Britain and Northern Ireland, it said that the committee is concerned about the impact on persons with disabilities in situations of emergencies, including flood and fire, and the absence of comprehensive policies related to disaster risk reduction that include people with disabilities in the planning, implementation and monitoring process of disaster risk reduction. So I think it was highlighted to the government prior to the pandemic.
Let's unpick that a little then. So is this the position that the United Kingdom is a signatory to and has ratified the UN Convention on the Rights of Persons with Disabilities?
And the optional protocol as well.
I was going to come to that. And it ratified that convention. The convention is itself dated the 3rd of October 2017. And I do apologise, it's dated 2009. Alongside the ratification of the convention, the United Kingdom agreed to an optional protocol by way of a side agreement. And following that process, did the UN committee consider the position of disabilities in the United Kingdom and consider a report from the United Kingdom on the committee's views on the level of disabilities here?
There was concern about the impact of changes in welfare spending, and this was expressed in 2000. This culminated in the inquiry published in 2016 that you refer to.
And in its concluding observations dated the 3rd of October 2017, did the UN committee consider, amongst a myriad of other issues, and I should say there were some areas in which it commended the United Kingdom for the positive aspects of its response, as well as addressing and identifying principal areas of concern. But one of the areas in paragraph 28, in fact, that the committee expressed concern about was whether, bluntly, the government was sufficiently considering the likely impact on persons with disabilities of emergencies.
Yes.
All right. And that is a document and of course is a concern which is relayed directly to the government.
Yeah.
Yes, it is.
Yeah.
What was another specific area of concern in the same concluding observations dated October 2017, a concern about the availability of high quality, timely and reliable data disaggregated, that is to say, addressing disability.
Yes, it was.
And Professor, what in general terms was the nature of the concern that was there expressed?
I think that there's not enough knowledge about the situation in which disabled people live, and where there are more general surveys or evidence around emergencies or pandemics or whatever, that isn't sufficiently disaggregated so you can see whether disabled people are doing better or worse. And I think the fact that we've referred and can refer to so much data about intellectual disabilities is because the Learning Disability Register, which all people with learning difficulties can be part of, and that does not exist for other forms of disability, and therefore it's harder to get data.
All right. You then turned to a number of other areas in which where, in relation to which you say disabled people face discrimination. Could we perhaps briefly review some of the figures in relation to employment? In 2018, which appears to be the last time for which these figures were available, were 51% of disabled people employed compared to 81% of non-disabled people.
Yes.
And there are variations also in relation to levels of pay and whether or not the occupation is part or full-time.
Yes.
Deprivation were and are disabled people as a group in a weakened situation relative to non-disabled people in the United Kingdom on account of the degree of deprivation that they encounter.
Yes.
And do you provide figures in relation to the poverty rate for disabled adults and disabled adults in working age families?
Yes.
Yes, we do.
All right. I'm not going to ask you questions about the links between poverty, morbidity and mortality, but because that is not at the core of the inquiry's work. But may I ask you this, professors, again, was this information, that's to say the levels of deprivation and the links between poverty, deprivation, housing, and in the context of disabled people, morbidity and mortality, well known to government?
Yes, it was. And it was published by Joseph Ramsey Foundation and by the Equality and Human Rights Commission in 2018. So that would have been publicly very available.
And are disabled people therefore more likely to live in inadequate housing, to have lower levels of security, be at greater risk of sexual domestic violence, and to be at greater risk of social exclusion?
Yes, and I think not only are disabled people more likely to live in poverty, but actually it is more expensive to live with a disability. There's an added cost to disability. So not only are disabled people, not only do they have less income, it costs them more. I think Scope do an annual extra cost of disability per month figure, and the poorer you are, the greater the additional cost as well. So these are all these are all available. All of these will be well known.
Turning to education, are there varying degrees of access to proper educational facilities, and in particular, a lack of access to special educational needs and disabilities resources?
Yes. And the situation is worsened in the last 10 years.
And is that the same across the United Kingdom? So does it vary by jurisdiction?
Well, it will do, but it's broadly the same across the United Kingdom, in Northern Ireland, in Scotland, in Wales.
I think Wales have recently introduced a new system, but I think it's fair to say that there are inadequacies in the provision of special educational needs for children across the country.
Paragraph 25, digital exclusion. This is relevant, of course, to the impact upon stay-at-home orders and to social distancing measures. Do disabled adults make up a large proportion of those adults across the United Kingdom who do not use the internet and therefore who may be said to be digitally excluded?
Yes.
Again, those are quite significant figures. Is that broadly known and understood as well?
Yes, I mean it's easily available, the information. So.
All right.
Yes.
Security, I needn't trouble you with because I don't think there's a sensible argument that measures imposed in the face of a viral pandemic need to be particularly nuanced to deal with the possibility of being a victim of crime and security. But what about social isolation and loneliness? Are many disabled people subject to high levels of social exclusion and segregation?
Yes.
Yes, they are. And sorry to interrupt you and to correct you, but due to the pandemic, people may spend longer at home. And if there are domestic violence issues in the home, they'll be more subject to them. And therefore, it is relevant to the condition it brought around through lockdown orders.
Yes. I should say, Professor, that paragraphs 27 and 28 appear to deal on their face with what I might call external crime, hence security.
Yep.
You've raised there the issue of domestic violence,
crime,
which is different to the question that I asked you.
I beg your pardon.
But let's have a look at that. What can you say about in general terms, the levels of domestic violence
I think
on disabled persons?
I think it's fair to say that home is not always a safe place for disabled people. That there is a lot of hate crime and so-called mate crime, where the person that the disabled person, where the person who's providing the care for disabled people can become the perpetrator of the hate crime towards them. So I think that there's a need to. This is well recognised that disabled people are often subject to such crimes, and that locking people down in that area is one that I think where there was significant risk and should have been.
I think disabled women are twice as likely to experience sexual assault in a given year than non-disabled women. That's very stark.
And so that we are clear about the position, the point that you make jointly is that stay-at-home orders would, of course, have a tendency to increase the vulnerability of disabled people insofar as they may be subject to domestic violence.
Yes.
A small minority, it certainly would.
Yes. Can we then turn, please, to the issue of access to health and social care? Without engaging in polemic debate about the merits or demerits of austerity, is it clear that there have been reductions objectively in the overall levels of funding for disabled persons over recent years?
Yes.
I would say that fewer people are getting support from the state. So it's the numbers. For any individual, it might not have gone down, but the numbers of people being supported have certainly gone down.
Were those reductions in the levels of funding, were they prevalent across society? So are they reflections of reductions in levels of funding in central government or at local authority level or in terms of access to the third sector? Was it a particular area or was it generally across the board?
Generally across the board, I think. But I think there's a general cut in the provision of social in the funding of social care, particularly so in England, and a reduction in the spending, and of course social care is delivered either by the local authority or by non-statutory agents such as the health authorities, or by through the third sector or private sector. So cutbacks would have been, so cuts in funding was apparent to across all of those sectors.
And as there were reductions in levels of funding, presumably the third sector, that's to say voluntary and community sector organisations, would step in to greater or lesser extent to assist. In the run-up to the pandemic, were there any changes in the capacity of the third sector or its ability to be able to provide services and resources where the state could not?
Well, the evidence is that there have been significant cuts to the third sector by sort of 2017, and that and that the cuts are greatest to those third sector agencies that are working in the areas of the highest social deprivation. So actually, it was the inverse care law was where more support was needed, there was more likely to be cuts to the services that provide care in those areas. I think that these have reduced the capacity of local authority of services to provide social care and support to people in those areas. And I think one of the things that's really important here is I know we're not talking about the pandemic, but actually the third sector played a really significant role in the response to the pandemic. And actually, we'd already set up, so we were disadvantaging these third sector organisations that were working in areas of high social deprivation were the ones that were finding it hardest prior to the pandemic to keep going.
And you mean by the third sector, just so everybody watching knows? By third sector, you mean?
Third sector, I mean voluntary sector organisations, not provided by statutory funding.
I think I described it to you as voluntary and community sector organisations,
yeah.
so non-state bodies.
Non-state bodies, yeah.
That operate and work in this area and provide help.
Yeah.
And because they're cuts that operated through local authorities, they are commissioning care, either in care homes or domiciliary care. They can't pay as much, and so the wages of staff is decreased, and therefore there are fewer staff, and therefore more, as it were, unmet need at the front line. And that's prior to the pandemic. That's by 2018.
So what you're saying in essence is that the viral pandemic and the impact, of course, of the government's necessary steps to combat it had a huge impact on the third sector. And it was a third sector which was already under very real stress and strain even before the pandemic.
And as Professor Watson has just said, would go on to play a really important part during the pandemic.
Yes, and I know my lady will be looking at that, particularly in the course of the healthcare and care sector modules later. Finally, although the passage and the part of your report is entitled Conclusions and Missed Opportunities, in fact you provide quite a bit of information about the access and the availability of data concerning disabled persons. And therefore I want to ask you in general terms about the provision of data, mindful of what the UN committee said in its concluding observations in relation to the need for data relating to disabled persons. As at the onset of the pandemic in 2020, was there widely available data expressly addressing the position of disabled persons?
No. Not that we know of, not.
Are you aware of whether or not the statistical authorities in the United Kingdom had produced either data sets dealing expressly with disabled persons or data extracted from opinion and lifestyle surveys, for example?
I think you're going to look at the Office of National Statistics tomorrow or in future days, and I think that only recently have they turned their attention to this issue. In the distant past, there were big surveys. More recently, they've done much better, but in the era which we're concerned with, there was nothing.
You refer, and it's plain from paragraph 40, that there was, Professor Watson, a research study carried out by the ONS concerning mortality. So in England, people with disabilities made up 59% of deaths from COVID. That was based, wasn't it, upon a 2021 census. So by definition, that must have been after the pandemic started.
Yes.
All right. And you are, I think, aware, and we'll hear more about it tomorrow, of an ONS Opinions and Lifestyle Survey which reported in April 2020 on the impact of coronavirus on disabled people. But again, that was after the pandemic had commenced.
Exactly.
All right. And so is your general conclusion at paragraph 41 that these broad areas of vulnerability and lack of access to resources, all well known, well debated, and therefore known to government?
Yes, these are public domain.
Thank you very much. Those are all the questions I have for you, Professor Watson, Professor Shakespeare. I don't believe there are...
I think I've got Ms Morris to ask a couple of questions.
Thank you, my lady.
Ms Morris.
Thank you. Good morning, Professor Shakespeare. Good morning, Professor Watson. I ask questions on behalf of the COVID bereaved Families for Justice. I have just a few questions for you, please, to expand on the single topic, digital exclusion. Mr. Keith has taken you through paragraph 25 and 26 of your joint report. Just to draw on a few of those facts and figures, please, for a moment. You've highlighted there that disabled adults make up a large proportion of those who don't use the internet.
Yeah.
And you provided data from 2017, which estimated that the number of people not using the internet was around 22%. You say of that, about 56% were people with disabilities.
Correct.
Yeah. Now, you've broken that down by age. Just interested in that for a moment, please. You report that in 2017 that 60% of non-internet users aged 16 to 24 were disabled people. And this proportion was in fact the same for those over the age of 75. So what does that tell us in terms of the age range of those who are disabled people and non-internet users?
I think it's to say that disabled people, I mean, like you said on the report, disproportionately, disabled people make up the largest numbers of people who were not internet users. I mean, we couldn't find the statistics that were disaggregated by poverty to see if this is, there might well be an impact because we know that more disabled people live in poverty. This might be to do with poverty as well, but there also will be significant numbers, and there are significant numbers of disabled people still who don't use the internet. There will be some who don't use the internet for reasons that are impairment related, but there are also some who just won't have had, who didn't have prior to the pandemic. I think that the pandemic, a lot of third sector organisations stepped in to help a lot of disabled people through those early years. I know, you know, organisations that I'm involved with were sending out tablets and instructions to disabled people at the start of the pandemic.
You're ahead of me, Professor Watson. Thank you. That's very useful. Are there particular disabilities that impact on online use? You mentioned intellectual disabilities. Is that the only example? I think,
yes, and the sight impairment might also be one. I mean, that's one of the ones that's listed in the thing. So where the internet is not accessible to disabled, it's not made accessible. Moving then to sort of the public health context, and you've touched on this already, Professor Watson in particular, about the movement of things online during the pandemic. What challenges are faced with individuals with, for example, intellectual disabilities, and their families and their carers in receiving public health information?
We obviously did research with disabled people during the pandemic, and I think people with intellectual disabilities found the messages very complicated, and they were changing, and they didn't always understand them. And even when they listened to broadcasts, they didn't understand them.
Mr. Keith touched on a moment ago some of the important topics that might include, like stay-at-home orders, testing, self-isolation, rules around contact with others, to give but a few examples. Are those areas where digital exclusion could have a disproportionate impact on disabled people?
I mean, I think so. I mean, in terms of explanation, but a lot of these, this was made available through the television, but for people to try and get access. And I know that, you know, a lot of learning disability organisations were putting information online, but if people didn't have access to that information, then and a lot of the easy read, where organisations relied on easy read, getting easy read out to people would have required online access, and if people didn't have the online access, there would have been pretty pointless putting it out there.
Could you just expand on what easy read is, please?
Sorry, it's a method of writing that becomes that's designed to be accessible to people with a learning disability. So it uses a lot of pictures and
Simpler phrasing.
Simpler phrasing.
I think we have an example of that, in fact, available to see at INQ 000273831. This is an easy read document provided by MENCAP, so one of those third sector organisations you mentioned a moment ago. And if we could just please move through, see an example. Is that what you're describing? Pictorial representations, clear English.
Fewer words, yeah.
Simple fonts,
Yeah.
easier to follow instructions. Yeah. Okay. Just to expand on what you said a moment ago, Professor Watson, about who was providing this information and who would be able to get this into the hands and in front of people who needed it. This is an example of something that's available on a website. Would it need to be printed out for somebody who didn't have access to the internet?
Yes, and it would have to be delivered to them.
Okay, and who would ordinarily do that?
Well, I'm not sure. I don't know. I mean, I GPs or
Okay.
other means.
So does it follow, sorry, that if someone requires this easy to read information, they are dependent on somebody else providing it to them from an internet source?
Very much so.
Yeah.
Thank you very much indeed. Thank you. Those are my questions. Thank you, my lady.
Thank you very much, Ms Morris.
Thank you, my lady. There are no more questions, I believe, for the two professors, so thank you very much.
Thank you very much indeed, Professors. In my time, I've seen a lot of expert reports and heard a lot of experts give evidence. If I may say so, yours was particularly helpful, focused and analytical, and really good. Thank you.
Thank you
very much. Thank you.
Would
Right,
my
I think
lady
I've been
rise for a
asked-
few moments?
Yeah, I think I've been asked to take the morning break now.
So be it.
So I shall return at 22.
All rise.
Please.
My lady, the next witness is the Chief Executive Officer of Disability Rights UK, Kamran Mallick.
Mr. Mallick, if you'd repeat after me. I do solemnly, sincerely and truly declare and affirm that the evidence I shall give shall be the truth, the whole truth, and nothing but the truth.
Could you please commence by giving the inquiry your full name?
My name's Kamran Mallick.
Mr. Mallick, thank you very much for attending and also for providing a witness statement, INQ 280035, which I believe you signed on the 21st of September 2023. Mr. Mallick, whilst I ask you questions, could you please remember to keep your voice up and go as slow as you humanly can in order to aid our stenographer? Are you the Chief Executive Officer of Disability Rights UK?
Yes, I am.
Was Disability Rights UK founded in 2012, and is it a leading national disabled people's organisation?
Yes, it is.
It has no doubt a number of functions and carries out an enormous number of worthwhile tasks. Could you please, in outline, tell the ladyship what, in essence, Disability Rights UK does, starting from the degree and the extent to which it engages with disabled persons and represents their voice?
Of course. So the first thing I would just want to start with, my lady, is that we refer to ourselves as the Disabled People's Organisation. We meet the United Nations definition of a disabled people's organisation in that it's led by and in control and governed by disabled people. That differentiates us from the disability charities that exist in the country. So disabled people organisations like ours are run by and for disabled people. We are a membership organisation. That means that we have individual disabled people as members of the organisation and other local and regional disabled people's organisations up and down the country who are also members of us. Our job is to listen to what's going on, what life is like for disabled people around the country, to learn and to then advocate to bring about equality, justice and equity for disabled people in our country. We also play a role in making sure that disabled people themselves have access to quality information about their rights and equality.
And are you, in fact, as a DPO, a disabled people's organisation, therefore majority-led, directed, governed and staffed by disabled people?
Yes, we are.
And in terms of the work that you do to listen to disabled people and disabled people's organisations, you obviously receive letters, you receive emails and calls, but do you also have in place and do you operate an independent living helpline, a student helpline, and also a group which you manage called Our Voices Group, which is a meeting of a variety of people, CEOs and staff from other DPOs across England?
Yes, we do.
And all that is, of course, aimed, is it not, at the state, at the government, in order to be able to communicate the views and concerns of your members and the other groups to government in order to pursue the aims that you believe are required to be raised with them.
It is. So we use all of those methods to understand what life is like for the vast numbers of disabled people around the country. We are not impairment specific, so we look at all impairments as well as people with long-term health conditions. And it is our role and our job is to understand what life is like and where there are inequalities and what should be done about them, and then to take that position and advocate, lobby, influence people in positions of influence and power such as government.
So, in short, you listen to the concerns of disabled people, you give them a voice, you take information from them, and then you campaign with government and other bodies for work to be done and for improvements to be made.
Yes, that's correct.
And I think you have a substantial reach on social media with a very large number of followers from X, formerly known as Twitter, and during the pandemic you had over 1 million visitors to your website.
That's correct.
All right. During the pandemic, so that is to say between January 2020 and spring 2022, did you, by a variety of methods, seek to raise with the government issues faced by disabled people?
We did. So we would do a number of things. We wrote countless letters where we were raising issues with different government officials in different government departments. We would write to the Cabinet Office, to the Prime Minister directly, raising concerns about a wide range of issues as they were occurring, pretty much in real time almost. We would also, where the opportunity arose, if there was a meeting that was put on by government, we would attend and make sure that the views of disabled people and our concerns were highlighted in those. And of course, we were then publishing both on our website and through Disability Rights UK's electronic newsletter that's going out weekly at the time, making sure that all of our positions were made public about what we were doing and what we were asking for and what our concerns were.
And that was your direct engagement. Did you also encourage members of your organisation and persons who have been in touch with you to contact their own local MPs if they had concerns and worries, and invite them to raise those matters with those MPs?
So absolutely. So we kept an ongoing record on our website of all the government decisions as they were being announced on our website. We would promote them through our electronic newsletter. And then the Our Voices group that you mentioned, it was meeting on every week on a Tuesday morning for 2 hours. And the purpose of that was to share that information across and make sure that local people could lobby, influence local decisions if that was relevant. So we were doing that throughout the 2 years.
Now I want to ask you some more detailed questions about the meetings that you had with government and the correspondence into which you entered with them. As a matter of coincidence, did you have arranged, and therefore did you attend, a short meeting on the 29th of January 2020 with the Minister for Disabled People, Health and Work, Justin Tomlinson, MP?
Yes, so we were asked to attend a short meeting with the Minister at that point.
Was COVID on the agenda at that meeting? Was it discussed?
No, from my recollection is that it wasn't discussed. No.
All right. Now, when the pandemic began, and of course the terrible consequences of the outbreak started to become apparent in March, were you extremely concerned on behalf of disabled people generally as to what the impact would be of the government's response and of course what the future would hold?
We were extremely worried, and we wrote a letter dated in March the 16th, outlining a list of our concerns. But actually, even before then, just by listening to what was happening around the world and what the impact was in other countries, and also it's our job to know disabled people in our lives and how we are potentially affected by potential disasters that may be coming along our way. So we were aware of what some of the risks would be, how our community lives their lives, the different ways that people have structured their lives to manage the inequality that they experience every day. So we, just through the sheer kind of engagement, but also the fact that we were disabled people ourselves, so we were living through and had the same concerns and worries that many of our members and constituents would have around the country. So we became aware and consciously concerned about it quite early on. And
because, of course, the government's response and the decisions that the government took were of such great width and there were so many of them, there was a great capacity, wasn't there, to affect?
There was. So when...
I'm going to ask you in a moment about each of those areas.
Okay,
so you
yes.
needn't you needn't enumerate them all
Sure.
by way of a response. But in blunt terms, you are having to address a large number of issues and cover a very wide turf in terms of the areas of concern that you were raising with the government.
Yes, we were. Yeah.
Let's have a look at that letter that you mentioned, Monday the 16th of March. It's INQ 238504. (238504). There we are. A letter from Disability Rights UK dated the 16th of March 2020, addressed to Justin Tomlinson MP, Minister of State, the Minister for Disabled People, Health and Work, and Helen Whately MP, Minister for Care. Just looking at that first page, please, Mr. Mallick, you plainly identified to the ministers, the two ministers, the expression of concern on this page, specifically in relation to the guidance on coronavirus, because you say it doesn't go far enough to safeguard the lives of disabled people, people with long-term health conditions, and older people. When you refer to current guidance, do you mean the guidance published? Did you mean the guidance published by the government addressed towards disabled and other people in relation to how they could be expected to respond to the pandemic and respond and deal with the government steps?
So we were referring to guidance issued by government in relation to disabled people in particularly select areas that they had released.
In geographical areas?
No, so in terms of, so for example, advice for care homes, so that kind of guidance that was being released at the time.
There was guidance to the country as a whole, but specifically England, issued around that time to the care sector. Is that the guidance that you had in mind?
Yeah.
I see. Specifically, the concern are already stretched thin by a pre-Brexit exodus of qualified skilled workers. They lack proper and meaningful advice. And you say the advice issued doesn't take full account of the ease of transmission of this virus within confined communities, relying too much on modelling for influenza. What did you mean by that reference to the fact that you believe the guidance relied too much on modelling?
So it was looking at how, I guess, their response to influenza and the modelling that they had around that, so how people should protect themselves. But we were in a situation where we had a virus that had arrived. There was no vaccinations for it. People in care homes, by the nature of why they're there, often have underlying health conditions, would have long-term health conditions, and so were at greater risk. And of course, if you are in a care home, you are in an environment with other people who are equally potentially at risk and have underlying health conditions. And so the advice being given wasn't adequate to protect those individuals.
The inquiry has heard evidence that pre-pandemic, the government strategy was based upon a historical approach to influenza pandemics. That the influenza pandemic, or as in this case, the coronavirus pandemic, would break upon the United Kingdom shores, and it would spread through the population. There was no debate about lockdowns or stay-at-home orders or anything of that sort, or society-wide restrictions. Was your reference here to the government having placed too much reliance upon that strategy and upon modelling a reference to the need, as you saw it, for the government to keep the virus under complete control, to stop it spreading, to reduce, to use the terminology, the level of incidence?
Yes, so the influenza modelling would be around kind of that idea of herd immunity, that if you let it spread, there's natural protection that develops within people. We felt that that was not the right thing to be doing within this particular virus.
Was it your position that the best protection was not to have measures for hand washing or for trying to control marginally the spread of the virus, but to apply complete control to reduce the overall levels of infection?
Yes. Yeah.
All right. Is that because, realistically, but particularly in the care sector, it is impossible to hermetically seal away any segment or part of the population?
Absolutely, and the way both care homes are structured, but also the care sector is much wider than just care homes. People receiving care at home, in their own homes, where you've got carers moving from home to home, visiting different clients through the day. So there's that increased risk of the infection being going from place to place just because of that nature. There was, because of the crisis the care systems was under, you had lots of temporary staff who were being brought in as well. And so because of those, the way the care structures are designed, it produced greater risk.
So in essence, Mr. Mallick, were you calling for, because of your concerns in particular about the care sector, a suppression approach rather than a mitigation approach?
Yes. Yeah.
If I may say so, very prescient. On that page, you refer, however, also to certain particular areas of concern: funding for isolation areas, advice to protect people giving and receiving care, emergency support, the training of new care workers, the stopping of attendances for benefits, which you deprecate, but you welcome the move to suspend face-to-face personal benefit assessments, and the general need to get money to people quickly and to reduce financial anxiety. So all more specific concerns that your group had. Did the government reply addressing each of those specific concerns or not?
No, the government reply was incredibly disappointing. They only referred to, the response really only talked about the benefits changes that they were making. They addressed none of the other concerns in their response to us.
Could we have, please, 238515? The government was, of course, at this time, the letter was dated the 9th of April, in the full face of the storm that was the pandemic, and may therefore be given some leeway in relation to its ability to be able to respond to correspondence. However, was the only issue that it actually sought to address at all in this letter the issue of the new guidance about claiming benefits and the introduction of the Employment and Support Allowance Regulations 2020?
It was, yes.
Did it respond at all in relation to any of the other areas that I've asked you about, or in particular the massively important strategic issue of whether or not seeking to mitigate the impact of the virus as opposed to controlling the virus would have on the very vulnerable care home sector?
No, so they didn't address any of those points specifically. They make general comments about how the government will do whatever it takes to support people.
Is the Minister for Disabled People, Health and Work based in the Department for Work and Pensions?
Yes, they are, my lady.
Oh, right.
in your statement, Mr. Mallick, you raise, in fact, this issue because you make the point of paragraph 90. Perhaps we could have that paragraph up on the screen from the witness statement, which is INQ 280035, page 27. You make this very point, the same point that Milady has made, which is that the disability minister sits within the Department for Work and Pensions and has therefore a low profile in government. And you also make the point that there have been 5 different disability ministers since you joined Disability Rights UK in July 2017. From your viewpoint, does it appear that politically the lack of a high profile for the disability minister has had an impact on the degree to which the government has, as you see it, been able to respond and address the particular needs of disabled people?
Without doubt. The fact that the minister sits within the DWP and therefore the remit of the minister is purely within the remit of what the DWP is about. And from our perspective as a disabled people's organisation, the DWP is fundamentally about getting people off benefits, reducing the benefit bill and getting people into work. That's the main focus that that department has had for many years. And that's the focus of the minister. When we meet with the minister and raise issues to do with housing or transport or health, the response will often be, that's not within my remit, therefore I can't answer that question. The other issue within government is if you localise the response to disability and disabled people in one department, it then means that the rest of government has no oversight, has no onus to respond to how what they should be doing in order to affect disabled people's lives.
You refer to a unit in the Cabinet Office called the Disability Unit. The Cabinet Office is, of course, that part of central government which seeks to coordinate government matters, broker issues between particular government departments, and plays a centralising role. Was there at one stage an expectation or a hope that the Disability Unit would increase the profile of disability-related issues in government?
So we looked upon it as a potentially positive move, that by situating the Disability Unit within the Cabinet Office, centralising it,
survey, Milady, that's the same survey to which Professors Shakespeare and Watson referred a few moments ago, for the financial year 2020-2021, which showed that there are 14 million disabled people in the United Kingdom. We make up 22% of the population. So is that a survey, Mr. Mallick, based upon based on self-reported information from disabled persons? Could you just help us with the terminology or the phraseology? Or disabled a little or not disabled? Was it that sort of survey?
So I can't recall how the questions are asked in the survey, but recognise themselves as disabled people. Often there is a delineation of kind of, classes, so physical disability, sensory, cognitive, and people would be able to tick those boxes,
Right.
as it were. But yeah, that's generally how these surveys are done.
Thank you. Returning to the chronology, you wrote to central government on the 23rd of March, raising concerns on the part of Disability Rights UK and a number of other charities, in fact, relating to the impact of the Coronavirus Act on disabled persons' rights relating to education, social care and mental health protections. Was there any resolution of those concerns? You raised concerns about the Coronavirus Act, but the Act, or rather the bill, had already been published and was just about to proceed.
That we saw as a direct result of the concerns we'd raised.
You provided feedback as part of the National Voices Group framework for the. Was that because MEAG was primarily concerned with providing guidance for intensely difficult ethical issues, matters of triage and the like, which would be bound to have a huge impact upon disabled persons?
We were, and we were specifically concerned that what resulted was a frailty index, and that frailty was being conflated with disability, and that the risk was that you would be seen to be frail just because you had a health condition or that you were a disabled person. But also our concerns were that in those kind of situations, if someone arrives in hospital and potentially is unconscious, or is not able to advocate for themselves,
the Act, which of course address all sorts of issues relating to the emergency measures that were taken and lockdown and so on. But that part of it which dealt with the devolved nations, in particular Scotland and Northern Ireland, granted them, those two administrations, powers to take powers, as it were, in order for them to implement emergency measures, in particular relating to lockdown and closing schools and so on. Is that right?
Yes.
And I mentioned particularly Northern Ireland and Scotland. Was that because, again, without getting too far into the detail, another aspect of the asymmetry that you mentioned earlier was that Wales had in fact had greater sort of emergency civil contingency type powers than the other two devolved nations?
Yes, those had been transferred under the 2006 Act.
And as you describe in your report, at the UK English end of things, the measures to implement lockdown were to be implemented under the Public Health Control of Disease Act 1984.
Yes.
And going over the page, please, to look at paragraph 76, what you say here in the first sentence of that paragraph is that one purpose of the Act was to facilitate a coordinated and consensual approach across the UK, but also to facilitate deviation where necessary. Is that right?
Yes, absolutely. Yes.
What do you mean by that in this context?
Well, I think there's two things. One, in terms of the coordination and consent or consensual approach, there's references in the Act, for example, Section 87, where it makes reference to the fact that a UK minister shouldn't make a provision and shouldn't bring it into force without the consent of devolved administrations. And I think that's important because it's stronger language than we normally see, for example, in the Sewell Convention. So that's one thing. And then the other is that it assumes that by giving these powers, it assumes that different actors in the devolved administrations might wish to use them. And so by giving them the authority to use them, it assumes that variation will flow from that.
Yeah, so on that analysis, the Act is really of a piece with the approach we were discussing relating to the action plan.
Exactly.
It anticipated a four-nations approach, which would allow for variation between the nations.
Which allowed for a consensual approach and one where there was good communication and the principle of consent, but fundamentally one that was varied.
Yeah. Now, the reason that is of some interest is that latterly there has been some debate as to whether that particular sort of legislative approach was the right one to have chosen.
Yes.
And Boris Johnson, not him alone, but Boris Johnson, particularly in his witness statement for this inquiry, has suggested that another approach might, on reflection, have been preferable. And can we, for these purposes, go to Mr. Johnson's statement, please, which is 255836, and start at paragraph 126, which I think is page 30. Yes, thank you. So we can see this is Mr. Johnson's reflection on these matters. He says, looking back, we should have thought much harder about the legal basis for the measures proposed. There's a respectable argument that we should have used civil contingencies legislation rather than public health legislation. By allowing for at least the appearance of a divergence in approach between the various parts of the UK, we were risking considerable public confusion and frustration when clarity of message was crucial. And then, if we may, one other paragraph in the same statement, paragraph 153, which I think is on page 37. Thank you. And if we see starting 4 lines down, he says this: it would perhaps have been better in retrospect if we'd formed policy under the Civil Contingencies Act 2004 so as to bind the UK together We should then have met regularly, UK government and DAs, to decide the policy in the singular together and to stick to it. So Mr. Johnson, Professor, thank you very much, and we can take that down, is describing an alternative legislative approach, which, as he describes, he in retrospect, thinks might have been better. Now, there are 2 points I want to address there. The first is just to, as it were, complete the factual story. We know that at the time, COBRA was advised that, in fact, it wasn't open to the government to use the Civil Contingencies Act. And let us look briefly, if we may, at the minutes of a COBRA meeting dated the 20th of March. If we can go to page 5, please. And yes, if we could zoom in on the bottom bullet point on that page, please. We can see recorded that the Civil Contingencies Act could not be used as this, that is the pandemic, is not an unforeseen event, and the Public Health Act was recommended instead. Again, Professor, I'm not going to ask you to opine on that legal question, but the point that the advice that COBRA appear to have received is essentially the Civil Contingencies Act is for something like an earthquake or a terrorist attack, which happens in the moment, whereas this is, albeit a crisis, something that, by the very nature of the COBRA meeting, could be seen coming. They were having meetings about it, and therefore the Civil Contingencies Act wasn't available. That appears to have been the advice that was given.
Yes.
And there are some other documents to a similar effect.
Is this legal advice?
My lady, I'm afraid I'm not sure. There are other documents, and at least one of them was referred to in the opening submissions, but I'm afraid I can't remember exactly the source of the advice within government.
I can see it might be, lawyers might have different views.
I hope I've made that clear, my lady. It does happen sometimes that lawyers have different views about things.
As if, Mr. Oakham.
But as I say, I certainly wasn't inviting Professor Henderson to resolve that debate, simply to see what advice was given at the time for completeness. Because perhaps the more important point to draw from this, Professor, is that what we see in Mr. Johnson's statement is a very different sort of approach to the question of how the UK and its constituent parts should have approached the crisis.
Yes, absolutely. I mean, it's not just that differentiation and diversity was allowed to happen. It was facilitated. It was foregrounded in the action plan. The means to achieve it were put into the Coronavirus Act, and that is within a general context in which devolution also leads to policy variation. So devolution leads to differentiation. The action plan said it was coming. The Coronavirus Act facilitated it. And then the Prime Minister also equated kind of divergence and differentiation and a lack of clarity of message. But one does not necessarily follow from the other. You can be very clear about differences that exist across the state. If you choose not to be clear, that's your choice in a way.
Thank you. And we know from the witness statements, at the very least, that the witness statements that have been supplied to this inquiry by the various First Ministers, Deputy First Minister of Northern Ireland, that their approach was very much that they wished, in the main, that they wished to take their own course, unlike the suggestion from Mr. Johnson. Is that fair?
Yes, and I think that has its roots in the fact that when you often see in the documents a phrase that the science says this, and the science says this, therefore we are going to do this. And I can't understand why the devolved administrations, are doing something different. But I think there's a number of points to be made there. One is that the data was not uniformly accessible, and data from different parts of the state could have led to different conclusions about what might have been the best thing to do. One could also imagine a situation in which different administrations would look at the same data and the same modeling and come to different conclusions about the appropriate plan of action. And I think it's also slightly disingenuous at times for people to claim the science said X, when in fact we know that there were arguments within the scientific community, including the scientific community of advisors advising the UK government. There were differences of opinion there. So the science didn't say didn't say one thing. And what we arrive at is a situation in which the UK government has interpreted the data to which it had access, often England-only data, and had identified a course of action and then expressed frustration that the others did not fall in line with that course of action, when in fact the devolved administration said, well, this is the point of devolution. Of course we're going to make our own evaluations.
Indeed. Let me move on, but in doing so, back to a topic that we've already touched on, which is the whole question of funding. In paragraph 81 of your report, Professor, so it's we've got it up on screen already. You deal with, you can see the title there, Changes to Funding from January 2020 onwards. So if we look at that and then go over the page, this is a paragraph or two in which you describe the effect of the Barnett mechanism. We don't need to go through all this detail, but Professor, in summary, the Barnett mechanism, or the consequence of the Barnett mechanism, was that where the Chancellor of the Exchequer in Westminster set up these extremely expensive schemes, we know about the furlough scheme, and the job retention scheme, that's the furlough, the bounce back loans and business interruption schemes and so on. They had possibly a complicated but a read-through into the Barnett mechanism and then extra funding for the devolved nations. Is that right?
Yes, when it was England-only spending, that then had Barnett consequentials for the devolved administration. So I think later in the paragraph it says, by one estimate, that meant the arrival of £7 billion to the devolved administrations.
Yes, I was going to take you to that. It's towards the end of that paragraph, isn't it? It's an OECD report, but in November 2020, so that's spending in the first 7-8 months of the pandemic, £7 billion, and you can see it, you've broken it down there between the three nations. So very large amounts of money, the extra money that was going to the devolved nations through the Barnett mechanism. And then, sticking with the chronological...
Sorry, just before you do,
yes.
So to ask, I meant to ask earlier, with the Barnett formula mechanism, if an England-only measure is something like the furlough scheme, so support for workers, is that ring-fenced when Scotland gets extra money, or or do they just get extra money which they could allocate to whatever they wanted? Yeah,
Barnett is not ring-fenced. So if it's spending on health in England, it doesn't have to be spent on health outside of England.
Thank you.
As I said, Professor, sticking with the chronological theme, we're sort of still in about March, April. And I just want to take you to a series of further references about First Minister engagement in core decision making. First of all, can I ask you to look at a letter dated the 4th of April. It's 217032. I see it's already up on the screen. I know you're familiar with this letter, Professor. This is a letter, is it not, from, in fact, all four First Ministers, but the 3 First Ministers plus the Deputy First Minister of Northern Ireland, to Boris Johnson on the 4th of April, so in the middle of the first lockdown. And we see from the second paragraph they refer to the fact that the lockdown measures were to be reviewed after 3 weeks, and the letter essentially contains a request for a considered process whereby they can take part in that review. Is that a fair summary?
Yes, they're identifying what they perceive to be weaknesses with existing opportunities to express their views and to influence UK decision making. So
they say we had these sort of crisis cobras, which were called at the last minute in the run up to the first lockdown, but now they describe something a predictable milestone, that is the 3-weekly review. Can we have an orderly process? And going over the page, they also say a transparent and collaborative approach to sharing and producing analysis options and so on in advance of a COBRA, and they describe their proposals as being the minimum commensurate with an approach founded on partnership across the 4 nations. And on a similar theme, if I could take you to a second letter, this time written just by Mark Drakeford, the First Minister of Wales, to Michael Gove. I see it's already up on the screen, thank you. This is a couple of weeks later on the 20th of April. And perhaps if we could go to the middle of the page. He requests what he describes as establishing a regular rhythm to meetings between the devolved nations and the Westminster government, where initially officials meet in the early part of the week. Then there's a meeting with Michael Gove in the middle of the week, and then finally a COBRA at the end of the week. So again, it's an attempt to put a sort of orderly process in place to capture that 4-nation decision making, is it not?
Yes. I mean, I think there's 2 things that are important here. The last line of the second paragraph, so assist appreciation of difference where that is necessary. So it's kind of an expectation that difference will be there. But in the previous line, this argument that there should be a common approach is also a call for consensus and communication. So it's not a letter from someone who is pursuing deviation for this or difference for the sake of it.
Yeah. So, the third of these documents from around this time is 91348, and this is a different type of document. This is an email within Whitehall. It is the part of it, anyway, that we will look at is a readout from a meeting between Michael Gove and other members of the Westminster, of the UK government, in particular the Secretaries of State for Wales, Scotland and Northern Ireland. And they are discussing, I think, in fact, that very letter that we've just looked at from Mr. Drakeford. Again, I'm not going to read it through, but the summary point is they're against it. And in particular, I think, in fact, if we can go to the next page, I know there are certain parts of this document that you find significant, and Professor will go back to them. But I'm sorry, I just need to. Yes. So if we can go to about halfway down this page, we see CDL. It's not the bottom CDL bullet point, but about 4 or 5 bullet points up. Can we see CDL conclusion? Yes. So it's the earlier of the 2 conclusions from the CDL. He says he's heard the Secretary of State TO, so that's the territorial officers, that's the Scotland, Wales, Northern Ireland Secretary of State's caution that regular meetings won't mean that DAs agree on the approach to COVID. And then this, regular meetings could be a, quote, potential federalist Trojan horse. He talks about being attracted to individual meetings. It's certainly a different view from that expressed by the joint letter from the First Ministers and then the letter from Mr. Drakeford.
Yeah, this is the most remarkable document I have read in a number of years. I mean, the phrase potential federalist Trojan horse jumps out, but also too on the first page, do a few references to the fact that the devolved administrations were exposed to UK government decision making, as if being in the room and listening to what the UK government was going to do was enough and satisfied commitments in terms of intergovernmental relations. I mean, it's also clear that Secretary of State for Scotland thought that weekly contact was too frequent and certainly didn't want it to roll on after COVID, and wanted bilateral meetings rather than multilateral ones. And so if we take it in the round, I think there's a number of things going on. But for me, what it looks like is that there were positions on intergovernmental relations and how the devolved administration should be integrated within a UK-wide response that were not driven necessarily by what would be best able to respond to an epidemiological event. It's clear that there was a desire to structure intergovernmental relations for ad hominem reasons, so there's a clear effort to control or handle one of the first ministers in particular. There's a fear of federalism, there's a fear of leaks, there's a perceived kind of venality or self-serving nature to the motives of the devolved administrations and a reflection, never a reflection that this might also be true for all actors, and no real expression in this document that there might be, that it might improve decision making if more voices from more parts of the UK were included in the decision making. So that's one thing to say. The other thing is that it looks to me like Michael Gove felt caught in the middle by this. And so we see this tension developing between the principles as laid out in the action plan and the principles in the Coronavirus Act and the reaction of Mark Sedwill and the reaction of Michael Gove on the one hand, and then the views of the Prime Minister, the views of the Secretaries of State for Scotland, Wales and Northern Ireland, the views of number 10 as well in later documents. And there's a tension at the centre in terms of how the devolved administrations should be accommodated.
Thank you, Professor. I'm going to move on. Those, let's remind ourselves, we're in April 2020. We will look at some later documents, and they will bring us back to similar themes. But as I said, I was going to address this by reference, first of all, to the first 3 months or so, which we've finished now, and then to look more generally at the later period. And it's paragraph 102 of your report, which starts to talk about this later period. And you make the point that, in general terms, the variation that we've discussed expanded. And from the time of sort of lifting the first lockdown, then on into the later part of 2020, the different devolved nations increasingly took their own course, whether it was the date of lifting the lockdown, the Welsh early circuit breaker in October. There are other examples, but the close sort of consensus on approach, which we saw in March, broke down, and that was the context during the rest of the year, was it not?
Yeah, I wouldn't say broke down. It just changed.
Or
Yeah.
it was no longer the case.
Yes.
And more different policies were pursued.
Yes, absolutely.
Taking a step to one side, one of the mechanisms that we haven't talked about so far is SAGE.
Yes.
Now, SAGE is an organisation probably many of us in this room know more about than we thought we ever would, and we're going to be hearing evidence from a number of people who sat on SAGE in the coming weeks. But you have referred to it in a number of respects in your report, and of course it was meeting throughout this period and, in fact, throughout the pandemic. And there are a couple of points you make about SAGE. First of all, relating to attendance by members of the devolved governments. You refer at paragraph 98 of your report to the membership lists which you've looked at, indicating what you describe as patchy engagement with the devolved administrations. And you also refer to the fact that at least one of them had what he described as part-time observer status. So can you expand on those points a little?
Sure. So one thing to mention is that the representatives from the devolved administrations weren't included from the very beginning. So there was an early attendee in one instance, but then when we get to the later in the period, then we start to see more regular attendance from representatives of the devolved administration. So they weren't included at the start and only included afterwards. And we had a shifting group of people who are invited to this, and because they weren't full members of SAGE, they, in some of the inquiry testimony, we see that they felt that they didn't have the same ability to feed information into SAGE.
Doesn't it depend on what the purpose of SAGE was? I think
Yes.
I've already heard that the purpose of SAGE was to provide scientific advice, and therefore the people who attended were selected for their expertise rather than their representative nature. So, in other words, is your criticism, if it is a criticism, which I think it is that fair if they're being selected for their expertise, not their representative nature?
But they're talking about data, and so SAGE focused overwhelmingly on England data. And if you don't have anyone in possession of Scottish data or Welsh data in the room, then your evidence base is partial.
Well, Professor, that links into the next point I was going to take you to, and that's paragraph 139 of your report, where you do make a series of points about a criticism, really, of SAGE focusing too much, I think, in your view, on English data, even though they would sometimes describe it as UK data.
Yes.
Is that the point you're trying to get across in that paragraph?
Yes, absolutely right. I mean, there's a unit of analysis problem. So, and it's not restricted to COVID. It is everywhere. People talk about the UK when they don't mean the UK. They mean England, or they mean Britain. They don't mean the UK, because Northern Ireland is almost always just sort of hived off at the start. So when people talk about having access to UK data, then they often don't actually. They have England-only data, and so England. It's a way of, there's an elision between England and the UK, but it also means that there's a kind of inability to look at England as well, that it's seen as, good enough to have data from England and for the rest, and just assume that what applies in England applies in the rest of the UK. But there are demographic and socioeconomic elements about England that are not replicated elsewhere in the UK. So there's a unit of analysis problem.
The elision point is one we'll come back to
Yes.
in other contexts, but sticking with SAGE, it's not just a data point. The point you make about in paragraph 140, so the next paragraph, you describe it as being terms of reference. So, for example, one of the examples you give is that SAGE thought about schools, whether schools should go back early, not go back, but seemed to have addressed their mind solely to the question of English term dates and left out of the equation the fact that Scottish term dates are very different.
The Scottish schools were already back when they were talking about whether they should be concerned about potential mixing in English schools. So it's just an English frame of reference tied to an English calendar and English data. And it's also the case that when they turned their minds to certain things, it was often because there had been a change in the rules that applied to England. But a comparable change did not apply in Scotland or Wales or Northern Ireland. So issues moved their way onto the agenda to an English rhythm.
Yeah. Well, these are matters we can take up with the SAGE scientists when we see them, in fact, later this week and on into next week. Professor, turning our attention to a different organisation, although associated with it, you are rather less critical of the Joint Biosecurity Centre, which was established in May 2020. The joint is an indication of its four-nation basis, and I think your view, and it's paragraph 99, I think Four Nations organisation.
Four nations by default, absolutely. And when we talk about intergovernmental relations, we often distinguish between vertical and horizontal relations. So vertical would be the centre and the other parts, and horizontal would be across the different units of a state. And so the JBC is an example, a rare example of pure horizontal intergovernmental relations. It brings in representatives from Scotland, Wales, and Northern Ireland, and the representative is there as the relevant health minister for England, because often in intergovernmental relations in the UK, they are neither vertical nor horizontal, or in a way they're both vertical and horizontal by virtue of the fact that the UK government wears two hats. So it renders everything a vertical form of intergovernmental relations and everything a horizontal one, and that muddiness of roles can cause problems. And this is a pure instance of horizontal IGR, and also one where it was seen as a four nations by default, but also it's a continuation of this understanding that different approaches are anticipated and normal.
Thank you. I want to come back now, Professor, in this slightly later chronological period to the question of the engagement at senior between the four nations at senior ministerial levels. And if we can please go to paragraph 126 of your report. where you summarise the position later in 2020, you refer to the fact that really COBRA ceased to meet after about mid-May for several months until well into the autumn. You record the fact that in late September, early October, Mark Drakeford said he hadn't spoken to the PM in months. There were more letters of the type we've seen, I'm not going to take you to them, requesting a more secure rhythm of meetings and for COBRA to meet again. In fact, it did during the autumn. You also make the point, in fairness, that frustration cut both ways, and that when, in the example you give, a member of the Westminster government asked to attend Welsh Government meetings, he was given a fairly short answer.
Yeah, received little response, yes.
Against that backdrop, I want to ask you about one or two other documents. First of all, can we look, please, at 137215, which is a submission to the Prime Minister towards the end of May 2020. And if we can go to the next page, please. We see, I won't take you to it, but this is in fact not from Mark Sedwill, but from Helen McNamara and Simon Case, so two very senior members of the Cabinet Office team, Simon Case not having taken over as Cabinet Secretary quite by this time. But it's a minute to the Prime Minister, and it is a similar document to the one we were looking at from Mark Sedwill earlier, in the sense that it is proposing a new scheme, a new set of arrangements for handling the crisis. The intention is to replace the MIGs with what we now know as COVID-S and COVID-O, that structure. And we see in the bold passage at the top, just as with the Mark Sedwill document, also raised is the question of how to, quotes, manage the DAs, and the suggestion is that there would be a joint ministerial committee mechanism. So if we can just pass through the document, we see, without zooming in, at paragraph 3, they are suggesting having a ministerial group shaping strategy. That's what became COVID-S. And then at paragraph 4 here, a COVID operations committee that became what we know as COVID-O. And then the devolved administrations are addressed at paragraph 6. It says, thus far the DAs have been involved in decision-making through the MIGs and in COBRA. There needs to be a mechanism to discuss and agree on a four-nation approach. And there's a suggestion that a joint ministerial committee should be convened when needed. COVID would stop meeting on COVID unless we re-enter a crisis situation, and a need to engage with the mayors. Question to Mr Johnson, do you agree to use the JMC to manage conversations with the DAs? Only use COBRA if we re-enter a crisis situation. We know from his witness statement, Mr Johnson did agree with that proposal, but in fact, the JMC did not meet during COVID, did it?
No, it did not.
And what we see from the materials and we see from witness statements and so on is that starting very much at the time of this document and then carrying on through 2020, the engagement between Westminster and the devolved nations primarily took the form of telephone calls with Michael Gove, the Chancellor of the Duchy of Lancaster, and the First Ministers.
Yes.
Is that right? It's fair to say that Boris Johnson, in his witness statement, says, well, that's what I meant. When I agreed to JMCs, I agreed to liaison with the devolved nations, and those phone calls with Michael Gove was sort of more or less what I had in mind. It doesn't seem to have been seen that way, at least by the First Ministers, as we've seen from your report, that they were later in the year pressing for more COBRA meetings. They weren't satisfied with the engagement that they were receiving. Is that fair?
Yes, I don't think it's the case that, I mean, you'll have to ask them, but I don't read from that dissatisfaction with the conversations with Michael Gove. I just think that there was a perspective that they weren't sufficient.
Yeah, and in fact, I think that's very fair, because many of the statements say in terms of receiving information and having routine frequent communication, they serve their purpose. It's just not the level of engagement that they wish for. Can we look, please, following in this vein, at paragraph 129 of your report?
Were the calls conference calls or were they calls one-to-one?
I don't know.
I think the evidence will show that they were group calls, but,
Right.
but there was also, you'll recall in that earlier email, a suggestion of individual calls as well. I think we'll find that it was a mix.
Thank
Lady,
you.
but the routine engagement was conference calls. Paragraph 129, Professor, it's here that you, first of all, refer to the fact that, contrary to that suggestion in the document we just looked at, the JMC, in fact, was never convened during the pandemic. And we see recorded there Mr. Drakeford addressing the Senate and indicating that at no point did anyone reach for the JMC structure. He says that that's not fit for purpose. But you make the observation towards the end of that paragraph. You say, in a way, these were cultural rather than institutional obstacles, or put another way, it was the spirit in which actors approached intergovernmental work that mattered. Okay, what do you mean by that?
So I think one example of that would be the document that you raised earlier, where there was a conversation between Michael Gove and the Secretaries of State for the territories. I mean, you can see there a very particular vision and understanding of intergovernmental relations that is not the one that you see sometimes from members of the devolved administrations. There's a lot of talk about the importance of having secretariats housed in particular ways and staffed in particular ways. But I think two things are relevant. One, what is the body and what is its purpose? And two, is its presence or is the frequency of its meetings down to the whim of individual leaders? And so I think there's a concern that the JMC structure was not fit for purpose in a crisis situation like this. You can well imagine that routine intergovernmental relations are really not helpful in a crisis. But I think there were noted weaknesses of the JMC. It wasn't seen as a decision-making body, and so therefore, in a crisis, you do kind of want a decision-making body where you can all contribute to joint decisions, if the principle of joint decisions and consensus is something that you say is important from the start. So it's about the organization itself, and then it's about whether it's ever called into action. And we know that the other weakness of
Can
the
you slow down,
Oh,
please?
sorry, I'm just getting excited about JMCs. So one thing is the weakness of the organization itself, and the other is that it was just in abeyance for most of the time. And so how you kind of wonder when people complain, well, they were never called, and it's like, well, you didn't like them anyway. So how annoyed can you be that they were never called? The UK is not the only state that had a kind of intergovernmental machinery that wasn't really pressed into service. And as we know, the whole point of it was to facilitate communication in plenary. It wasn't meant to be convened very often. So you can understand why it wasn't pressed into service.
And so when you talk in that paragraph about cultural rather than institutional problems, and what lies at the heart of this is the spirit in which people approached their engagement, would another way of making that point be to say that the problem here is much larger than just whether the JMC was convened and told to meet?
Yes, absolutely.
There's much more going on, isn't there?
Yes, but the fact that you have an organisation you don't convene is a symptom of that same lack of a kind of spirit.
Let me ask you about another passage from Boris Johnson's witness statement. So can we go, please, back to his statement, which is 255836, and it's paragraph 188. This is a statement, or a part of his statement, which, as you may know, Professor, the First Ministers have all been asked to comment on. But he says this: it is optically wrong, in the first place, for the UK Prime Minister to hold regular meetings with other DA First Ministers, as though the UK were a kind of mini EU of 4 nations, and we were meeting as a council in a federal structure. That is not, in my view, how devolution is meant to work. This, of course, takes us right back to your evidence at the beginning this afternoon about the difference between a multi-level state, or rather a unitary state, and a federal state. What's your view about this statement?
Well, we often evaluate mechanisms and organizations for implementing intergovernmental relations. We evaluate them on a number of criteria, and one of them is parity of esteem. And so the task then becomes, in each instance, is there parity of esteem? So the JBC, parity of esteem across the health ministers, so that's a good thing. This is an instance of the Prime Minister saying, but parity of esteem is not a goal. In fact, I find it distasteful because it implies that there is parity of esteem. I don't believe there is.
This, after all, is exactly what Mr. Drakeford and the other First Ministers have been asking for in those letters we looked at earlier. Regular meetings between Mr. Johnson and the other First Ministers so that they could meet, to use Mr. Johnson's words, as a council to decide on a joint, not necessarily uniform, but joint approach to COVID. Mr. Johnson appears to take the view that that is not only not the right answer, but that there's something constitutionally wrong about that answer.
I don't even know if the wish was joint. You'll have to ask them, but I don't know if the wish was joint decision making so much as an opportunity to inform UK government decision making. And I think that's an important distinction. But certainly, the spirit of this paragraph and the spirit of the statement from the record of the meetings with the Secretaries of State for Scotland, Wales, and Northern Ireland help one to understand why we have the intergovernmental relations architecture that we do.
And it's, again, I won't go to them. We can ask them themselves when they give evidence in the later modules, but it's certainly the case that, by and large, the First Ministers profoundly disagree with this statement.
Yes.
I want
as would most in a multi-level state, to be honest. I mean...
I want to go back, if we can, to your report and go to page 43, please.
Mm-hmm.
Because there you refer to Michael Gove's angle on this issue, if I can put it that way. At the top of the page, you refer to one devolved minister as having said the choice not to talk with us as equals was plain and obvious. And then you refer to Mr. Drakeford saying something similar. But then you can see in the indented passage, you refer to Michael Gove's account, where he said they were, as it were, faced with a problem. What are we supposed to do? Are we supposed to invite them to our cabinet committee meetings where decisions need to be taken urgently? Or do we make an agreement and then, as it were, tell them what it is, and they'll complain that something's being imposed on them? And I think your analysis is that might be or at least a self-created problem on the part of the British government, or the Westminster government.
I think in this instance, Michael Gove is treating, is portraying as external constraints that are of the UK government's making. The reason it's difficult to decide, well, should we have them in a cabinet subcommittee or not? Well, you decided to have the decisions made in a cabinet subcommittee. You didn't need to. They could have been in COBRA. Admittedly, that's for a crisis at the start, so you can understand why it's not COBRA all the way through, but you had the MIGs. You could have kept with those. The reason you have this problem about the cabinet subcommittees is because you created the cabinet subcommittees and wanted decisions to be made there. And likewise, if there's a lack of clarity about status and role, that's because since 1999, we have perhaps devoted less attention to clarifying what that status might be and how we generate organizations or mechanisms for good intergovernmental working.
Sticking with the theme of whether the devolved ministers should or shouldn't be present at cabinet meetings or cabinet committee meetings and COBRA for that matter, the evidence also raises perhaps a rather more basic practical point about trust and whether the individuals that we're concerned with were actually capable of working together as sort of trusted partners or not. Let me take you to one or two documents. First of all, I'd like to take you to a sort of letter that the inquiry received from Dominic Cummings, which contains screenshots, amongst other things, of WhatsApps between him and Boris Johnson. So can we go please to 48313, it's page 22. This takes us back to the early days, so if we can look at the bottom half of that, please. So this is a WhatsApp from Dominic Cummings to Boris Johnson on the 12th of March, so back before the first lockdown. He says, "You need to chair daily meetings in the cabinet room, not Cobra, on this," I mean, I think we can assume that means COVID, "from tomorrow. I'm going to tell the system this, not with the DAs on the fucking phone all the time either, so people can't tell you the truth." And we can ask him when he comes to give evidence, but the inference there is that the devolved ministers are not trusted partners, that Boris Johnson can't receive sort of full, truthful advice when they're at the meeting because they can't be trusted perhaps to keep it confidential.
Yeah, it's not clear whether, and this is something that could be put to Mr. Cummings, is the issue that by their mere presence, people were constraining what they were saying, and therefore, a propensity to be more free-talking might have led to better decisions, or is it a fear of leaks? I don't know what's implied by that, but on the former, it's worth asking whether there was such a more free-talking Cobra possible, and if so, whether that more free-talking Cobra would have made different decisions than the ones that were made. I think that's unknowable, but perhaps he has evidence.
Well, it's certainly something we can pursue, but it is possible to take this matter just a little bit further on the statements we have. I'm going to take you briefly to two further references. First of all, if we can look at Arlene Foster's witness statement, please. It's 274192, page 1. This is a recent account she has given. And if we can zoom in on the first paragraph, or the little A, starting about 5 lines down, where it says Nicola Sturgeon would brief. But that's fine. Can you see 5 lines down? It says Nicola Sturgeon would brief the media ahead of an upcoming announcement by the Prime Minister. I imagine this led to UK government being perhaps less open about its decision-making than it otherwise might have been in a bid to stay in control of messaging. So, for what it's worth, that might help us to understand what Dominic Cummings was referring to in his WhatsApp. But then let's also see what Nicola Sturgeon had to say about this, and that is in her recent witness statement, 273749, page 11, please. It's the last paragraph of her witness statement. She says, "On the issue of briefing the media, I consider that to be a core part of the job I had to do. Given the situation we faced, the extraordinary sacrifices people were being asked to make, my judgment was that building trust in government was essential to achieving the compliance that was necessary. A key part of that was ensuring quick, clear and open communication that explained what we were asking people to do and why. That's why I undertook daily media briefing." So she...
Mr. O'Connor, I think we're stretching a bit beyond this witness's expertise.
Yes, well, lady, yes,
Well, except that we do have data on trust, and we do know that the Scottish electorate and the Welsh electorate trusted their own devolved governments more than they trusted the UK government in terms of its handling on COVID. And given that so many of the decisions were actually not wildly different, but were variations, and we also asked questions about the rollout of the vaccine, which was also very similar across. The explanation for that is largely to do with the different scores that people gave in terms of communications. So the electorates in Scotland and Wales did have higher levels of trust in the devolved administrations, and we can attribute that almost exclusively to the different way that those governments communicated their decisions to their electorates. However, the other side of that, I can well imagine that routinely briefing news ahead of the Prime Minister was deeply annoying to the Prime Minister, and it's not just that. I think also that in building trust in the Scottish Government, there is a possibility that by briefing early, it also undermined trust in the UK government. And on that, we don't know. But we do have decent trust data for Scotland and Wales in particular.
Yeah. And those matters which you go into in a little bit more detail in your report, are they not, Professor? Thank you. Now there are, I think, really perhaps three short points I wanted to finish with. The first two of those are two obstacles to policy variation that you address in your report. The first of those takes us back to the Barnett situation and economic levers, as you described them in your report. So can we go, please, to paragraph 134 of your report, page 44.
Mm-hmm.
The high-level point you make here, Professor, is that, and this was a point I referred to when we were looking at those tables, is that it's one thing saying to a devolved government that it has power to act in a certain area, but often undertaking that action will cost money. And it may be that the example of COVID is a very good one in that respect, because to initiate a lockdown, to use a general term, couldn't be done practically without a great deal of funding to make up for the furlough scheme, bounce back loans and so on. And that was a problem or an issue, at any rate, that devolved nations faced during the pandemic, wasn't it?
Yes, absolutely. Because the funding for the furlough scheme came from the UK government, and the UK government, you can think of it like in the report I use the metaphor of a money tap being turned off and on. The tap was turned on when England was in lockdown. And so if England wasn't in lockdown, the tap had not been turned on. And it made it very difficult, therefore, to impose a lockdown in Scotland, Wales, or Northern Ireland if you didn't have the fiscal levers to support individuals and businesses that could not earn income. And so there was frustration that perhaps a clear policy path had been identified, but the devolved administrations couldn't act on it because they didn't have the financial resources to do so. And in fact, some have said that actually that fact that fueled policy convergence was a benefit of the arrangements.
Those who thought, like Boris Johnson, that policy convergence is a good thing, expressed that view.
Yes.
Of course, not everyone did think that was a good thing.
Yes.
And if we can look, please, at a letter, another of the letters from Mr. Drakeford. This one is 228013. We'll note this one is much later than the other documents we've been looking at. So this is December 2021, so during the Omicron wave. He really makes the point that we've been discussing. If we look at the paragraph starting, however, in the circumstances we now face, he's talked about the approach so far to the public health crisis. Then he says this: the Welsh Government is inhibited from considering a full range of mitigation measures because we are unable to access Treasury funding to support public health options. Put plainly, Wales and the other devolved nations can only access Treasury funds when the UK Government decides the time is right for such measures in England. And that's, in a nutshell, what you've been describing, isn't it?
Yes.
And we can see that in the rest of the letter he's asking for funds to be made available so that the Welsh Government can impose their own measures, even if those measures aren't imposed throughout the UK.
Yes.
that was one of the points. Another point, just to touch on briefly, in fact, it's in the next paragraph of your report, so 135, is the question of borders. Again, it's something I mentioned right back when we were looking at those tables. There was an issue, was there not, with whether borders were properly something that were to be dealt with by Westminster government, as it were, as an international matter which was therefore reserved, or whether border access through borders was something that was a health matter that was therefore devolved.
Yes, and I think that's why when the devolved administrations took action that related to the external border, it was variations in terms of health rules about quarantining or testing upon arrival and things like that, rather than certainly members of the devolved administrations at different times have complained that they were not, because they were not able to control the arrival of people from outside the UK into their territories. It meant that the virus continually was receding, and that's obviously something that was relevant in Scotland and Wales, but it's a particular issue in terms of Northern Ireland, given the open border with Ireland. And there was not just frustration about, it wasn't so much frustration about jurisdictional competence, but the arrangements with the Republic and whether they could get the information they felt they needed, for example, from arrivals who were coming to Ireland and then travelling on to Northern Ireland. They felt not being able to access that information caused them problems.
Yeah. And then finally, Professor, a point which you addressed in a little detail in your report, but I'm going to just ask you a few questions about it now. It takes us back to the point you were making earlier about the elision between the UK and England. We talked about it earlier in the narrow context of SAGE, but I think you hinted at that stage that it's a broader question, and you certainly describe it in your report as being a broader issue, and you refer, for example, to Ofcom talking to broadcasters about whether they had got their message straight about whether particular measures were focusing on the UK or on England, but you go on to say that the government, or the UK government itself, made similar mistakes and was guilty of referring to the UK when it really meant England.
Yeah, so I quoted all the daily press conferences, the printed pre-prepared material that's available online. You can analyse it to see whether the UK government clarifies when something about the UK is clarified as being about the UK, or when something that applies only to England.
I think you need to slow down a little bit more again.
When something that applies only to England is clarified as such. And in the first 2 months, this almost never happened. Whoever was the spokesperson of the day typically did a better job in clarifying when a UK-wide issue was indeed UK-wide, but that's often because the UK-wide issue was information about data, and so they were clarifying that it was UK-wide data. Almost never in the first 2 months did they clarify when an England-only issue applied only to England. And in fact, I can find in all of the daily press conferences only one instance in late May of 2020 when I think it was Matt Hancock clarified these are rules that apply only to England, and this is what the rule is in Scotland, and this is what the rule is in Wales, and this is what it is in Northern Ireland. Sometimes, in a handful of situations, the spokesperson would say, these rules apply only to England, the devolveds have their own rules. Right? But persistently, you get this failure to clarify that changes to rules about the reopening of car showrooms or the reopening of offices or bike voucher schemes. The report lists about 20 different types of policies that it talks about, never once clarifies that those were changes or policies that applied only to England. And that's important because a lot of what they were talking about had an impact on behaviour. They wanted citizens to change their behaviour. But when the rule applied only in England, it was only English residents whose behaviour would need to change, and that wasn't clarified at any point, and it led to confusion on the part of electorates in Scotland, Wales, and Northern Ireland. And it meant that the media picked up those statements and ran with them, and also didn't clarify what applied to England alone and what applied to Scotland, Wales, and Northern Ireland. And so bad was the lack of clarity that Ofcom got involved. And Ofcom issued 3 different kind of statements about media reporting on COVID. And the first 2 are urging for more clarity about medical matters. But the third one talks about the representation of diversity across the UK and urges broadcasters and print journalists to be clear when a rule or a change applies only to a particular part of the UK. There was a chronic lack of clarity from the UK government about when it was speaking on with its Government of England hat on, and when it was acting or speaking with its UK government hat on.
And if I may, in conclusion, just to round off this point, Professor, just to provide one illustration of this problem, if we can look at one last document, please. It's 216525. This is it's similar to other documents we've seen because it's a readout, an email describing one of these calls, Michael Gove's calls with devolved ministers. It's an email it's written not at Westminster this time. It's in Cardiff, in Mark Drakeford's office, I think. But we can see this is in July 2020 that Michael Gove has told them about the next chapter in our plan to rebuild document, and we see that, and I'm looking in the third paragraph down where it says MG, that they say, well, they'd actually received it 15 minutes before the meeting. And then if we could zoom back into the main part of the document, please, that the FM, that's Mr. Drakeford, first of all, he said he's only had time for a quick scan of the document. Then he says it mixes up UK and England in a number of places. And he explains where. Then he once again pleads for clarity that when the PM speaks, he makes clear when the actions he's announcing are England-only measures. And then a couple of paragraphs down, he picks up on another strand of all this, which is to say, well, actually, our message is not the same. And at that point, Boris Johnson was encouraging people to go back to work. And we see Mark Drakeford saying we're keen to maintain home working because of its benefits in reducing risk of transmission. And there were other examples, were there not, where the devolved governments declined to adopt Westminster government messaging.
Yes.
Professor, thank you very much indeed. Those are all my questions. There are just going to be 5 minutes or so, I think, of questions from one of the other barristers.
Ms. Shepherd.
Thank you, my lady. Professor Henderson, I act on behalf of COVID-19 Bereaved Families for Justice Cymru. I've got 2 questions to ask you, and they are on disparate topics. But the first one relates to border control. If we could have up on the screen, please, 83851. On the front page, we can see there that these are the minutes of a COBRA meeting held on the 12th of October 2020. And if we could turn, please, to page 7. At paragraph 11 of page 7, the First Minister of Wales, who we know as Mark Drakeford, raises a number of points. The 5th line down, it is said that he was disappointed that the travel restrictions from parts of England to Wales remained subject only to guidance, as opposed to enforceable restrictions. Goes on to say that the ability for cross-border travel between areas of England with high infection levels and Wales left people situated within medium and low areas of infection in Wales susceptible to increased risk. As you discussed earlier, we know from your report that all 4 nations issued their own regulations to restrict international travel. My question is this: were internal border restrictions between England and Wales a matter for the Welsh Government, the UK Government, or both?
Yeah, it's an interesting question, and one probably, that particular phrasing of it is probably best put to a constitutional lawyer. But one thing we do know is that if we look on the website of the Senate, they have a list of all the regulations and restrictions that they approved during the pandemic, and they have a handy little table that locates the parent act from which they think they have the authority to make that regulation or that restriction. And in the case of the restrictions that were made on just a few days later, I think this was the 12th of October, and then on the 16th of October, there were restrictions made for people traveling from areas where there was higher rates of illness to areas inside Wales, not just in terms of England. It's clear that they felt they had the authority to do this because of the Public Health Control of Disease Act 1984, and particularly they were drawing on Section 2A of the Act and Section 45. And I think it's three different sections, three different parts of Section 45, and then the last fourth one is Section 45R, which says that they don't have to lay that before the Senate; they can just issue the regulation. So there was one in October, there was another one in December. So certainly they felt they had the authority as a result of the powers that they had by virtue of the Public Health Control of Disease Act 1984 to make that change. It's noteworthy that no other devolved administration made that change, but I think Schedules 18 and 19 of the Coronavirus Act give similar powers to Northern Ireland ministers and Scottish ministers. The other thing I would say is we know that this was not, this was a controversial regulation. Erecting internal borders within the Union was highly controversial, and for the most part, one's view of the Union and one's understanding of the Union kind of helps us to understand how someone might react to it. So those in the devolved administrations, certainly those who want constitutional change or greater powers for the devolved administrations, were generally more satisfied with it. But on the more unionist side of things, there was deep discontent with the establishment of internal borders.
Thank you. And then my next question is, at paragraph 93 of your report, I'm not suggesting we bring it up on the screen, you discuss how the Joint Biosecurity Centre was integrated with Public Health England into the UK Health Security Agency. What was the impact of the JBC being subsumed into UK HSA on intergovernmental working?
Well, the most obvious change is that its minutes were no longer available for me, for anyone to read, me included. So there is some lack of clarity. But if I had to summarize the effect of that change, it would be that the JBC, which had worked on the principle of parity of esteem and good horizontal intergovernmental working, then became subsumed into an organisation, although it had UK in its name, was fundamentally concerned more with England than with the UK as a whole.
Thank you. Thank you, my lady.
Thank you very much, Ms. Shepherd. Thank you very much, Professor Henderson. I hope you don't get teased by family and friends for getting excited about JMCs, but you've been extremely helpful. Thank you. And I think you've travelled down from Scotland to be with us today?
I did.
Well, thank you for making the journey.
Thank you very much.
10 o'clock tomorrow?
My lady, yes.
Thank you very much.
All rise.